Today we'll see the efferent component, efferent functional component, that is motor component of cranial nerves. So again, similar to the afferent column, here it is divided into somatic and visceral, and under somatic general, special. In this side, visceral again subdivided into general and special. So let's see what are they actually means. General somatic efferent. General somatic efferent. So remember, here we are talking about the motor supply. Okay. So general somatic efferent, it is going to supply, or this component is going to supply skeletal muscles of somatic origin. Now, when we think about the skeletal muscle origin, skeletal muscle can have two origins. Okay, I'm talking about a little bit of embryology. Skeletal muscle can have origin from the somite. Somite, you might have heard about somites when we studied embryology. So that is one origin. Other origin of skeletal muscle can be from visceral or branchial arches. Branchial arch is a structure that is seen in the neck region. So some of the muscles of neck region are formed from branchial arch. So these are the two origins of skeletal muscles. Now, when we see the nerve supply of the skeletal muscles originating from the somite and originating from the branchial origin, they are different. When we consider the muscles, skeletal muscles which are derived from somite, they are supplied by, or they are belonging to, general somatic efferent component. Whereas when we see here, first of all, let me tell you one thing here which I missed to tell you, that here special is not there. Okay, special component is not there. Here you have only general somatic component, general somatic efferent. Here it is general visceral efferent, special visceral efferent. This component is absent. Okay. So this component is absent here, special component. Whereas in the sensory component, we have seen everything, right? Yeah. General somatic afferent, special somatic afferent, general visceral afferent, special visceral afferent. When you come to this area, this one is absent. Okay, you can see general somatic efferent. So that we have already seen. Now coming to the next, that is general visceral efferent. General visceral efferent that supplies smooth muscles and cardiac muscles, also glands. All of them are supplied by autonomic nervous system. So autonomic nervous system usually supplies the smooth muscle, cardiac muscles, and the glands. So this belongs to general visceral efferent because they are going to be seen surrounding the viscera, or they are the viscera itself. Now the next one here is special visceral efferent. Now when we say special visceral efferent, that means again it supplies skeletal muscles of branchial origin. That means some muscles which are seen in the neck region are going to get supply from special visceral efferent. So general somatic efferent, it is supplying the skeletal muscles of somatic origin. Remember that somite muscles which are, or skeletal muscles which are derived from the somite. Okay, somite. Whereas general visceral efferent component supplies muscles, smooth muscles, cardiac muscles, which are involuntary, and also the glands. So basically they are autonomic. They belongs to autonomic nervous system. Special visceral efferent, which supplies skeletal muscles of branchial origin. Okay. Now, with this, we will see the cranial nerves. Now, cranial nerves with efferent or motor fibers. These are the cranial nerves. Cranial nerve 3, 4, 5, 6, 7, 9, 10, 11, 12. They all have a motor component. But when we consider C3, that is cranial nerve 3, 4, 6, 11, and 12, they are pure motor. They don't have any sensory component. So they are motor. Whereas when we consider these cranial nerves, that is C5, the remaining one, C5, C7, C9, or cranial nerves 5, 7, 9, 10, they are mixed type. They're mixed type. That means they have sensory component as well as motor component. So that you should know. The other one here is that we already mentioned that cranial nerves 3, 7, 9, 10 are having, or they have the parasympathetic system in it. Parasympathetic system is going to flow through it. We have seen the parasympathetic system. We saw that it is craniosacral outflow. The cranial outflow is through oculomotor, facial, glossopharyngeal, and vagus cranial nerves. So these things you should again, should remember this. So these are regarding the efferent component. Efferent component. So pure motor, mixed, and fibers which are carrying parasympathetic system. So they are here in this actually. You can see here general visceral efferent component. That is the parasympathetic component. We'll see that in coming slides. Yeah. To make you better understand regarding the efferent component, let's talk about this structure here, that is somite. Okay, we are talking about this one, general somatic efferent. So I said general somatic efferent supplies the skeletal muscles of somite origin. Now what is somite? We have already seen the somite. These are the somites which you can see here on either side of the developing neural tube. You can see here, this is the somites. Okay, this is another picture where the dorsal and ventral aspect can be seen, and the somite is formed in this region near to the neural tube. This is a notochord, and you can see here the different bulgings which are produced here. Okay, so they are arranged in this area in the trunk region, and when it goes to the head region and caudal region, there are some changes as you can see here. Okay, and this is what happens to the somite. Somite usually it's a single structure. Later it divides into three parts. As you can see here, the different parts of a single somite would be dermatome, myotome, sclerotome. So it divides into three actually. On outer aspect, dermatome, then myotome, then sclerotome. So dermatome give rise to the dermis of the skin. Myotome give rise to muscles. So we are talking about the muscles here, right? These muscles, general somatic efferent muscles, they are coming from myotome. So myotome is here. Then deeper to that, sclerotome. Sclerotome will give rise to vertebra. So this is just to make you understand what is these somite. So here you can see the neural tube, and you can see the dermatome, myotome, and the sclerotome. So somites are seen on either side of neural tube. They are derived from intraembryonic mesoderm. We can go back and see the development of somites in your embryology class. Now we are going to see again some early development of head and neck region, which is having some difference from other part of the body. So as I mentioned before, here you can see that the skeletal muscles are derived from the somites, right? And another origin of skeletal muscle is from the branchial arch. And I said branchial arch or the visceral arch, which is usually seen, you just think of it, right? Visceral arch. That is why it is mentioned here, right? Special visceral. So visceral arch. Yeah, anyway. So visceral arch or branchial arch, they are seen near the neck region. So we need to know what is this actually, this branchial arches. So we have seen the somite. Now what is this branchial arch? Look at this region, neck region. You can see that there are some arch which are formed in the neck region, and they are the branchial arch. We will see better in this picture also. Oh, it is not there. Okay, doesn't matter. Oh, I think I'm sorry. The branchial arch is not shown in this. These are the myotomes. Let me find out. Mhm. Anyway, I'm sorry for that. The branchial arch is not mentioned, but try to think in this way that there are there are some arch which are going to form in the neck region, and they are called as visceral arch. Okay, I'll try to show you the picture later, but again we are still in the myotome. Okay, in the somite, we're continuing the somite. Many structures in the body are derived from somites. Okay, so somites can be seen throughout the body, isn't it? You can see that throughout the body, but in the head and neck region it is differentiated in different way, as you can see in this, which is marked as red, and here also it is having some other fate. However, only two groups of muscles in the head are derived from somites. So in the head region, there are two groups of muscles which are going to derive from the somites. Or other way, you can say that in the head and neck region, the somite shows some changes in the head and neck region. So what is that? There are two groups of somites, as you can see in this picture. A pre-otic myotome that is seen, another one is occipital myotome. So occipital myotome is located here in this region, in the cervical region. Then the other region, there is another group of myotomes which are together, that is called pre-otic myotome, that is seen near the ear. That is why otic means ear, pre-otic, in front of the ear. So usually the somites are seen on either side, which are numbered actually. But when we look at, so it's numbered from here, 1, 2, 3, 4, like that. But above this, also there are myotome, which are aggregated, and they form something called these things. The two group of myotome, one is in the neck region called occipital myotome, other one is seen in the ear region, that is pre-otic myotome. You can see here the numbered myotome or somites, which is below that. You can see that, as you can see here also, numbered 1, 2, 3, 4, 5, 6, like that. So because of this aggregation, what happens here is that because of pre-otic myotome and occipital myotome, these two groups give some group of muscles. They are the pre-otic myotomes. They give some muscles of eyeball. They are the extrinsic muscles of eyeball. We have seen the extrinsic muscles of the eyeball. They are basically derived from pre-otic myotome. So pre-otic myotomes are nothing but they are somites which are arranged, which are grouped in the ear region. Similarly, occipital myotome is going to give rise to muscles of tongue, and muscles of tongue we have already seen. Now, usually the pre-otic myotome is supplied by a cranial nerve, a group of cranial nerve, as you can see here, oculomotor, trochlear, abducens. So since the pre-otic myotome is going to give rise to extrinsic muscles of the eye, you can see that extrinsic muscles of the eyes are supplied by oculomotor, trochlear, abducens. Similarly, occipital myotome is usually supplied by hypoglossal nerve. So occipital myotome is going to give rise to muscles of tongue region. You know that muscles of tongue. So that is the reason you will see that all the muscles of the tongue are supplied by hypoglossal nerve. So remember, all these things are, we are talking about general somatic efferent. What do you mean by general somatic efferent? It is the the muscles, skeletal muscles, which are derived from the somites. So all of these are somites. All these muscles, what we talked about, are derived from the somites, because we have seen here this picture, the somite. Okay. Now look at that here. Again, you can see in this, we are talking about this one, general somatic efferent, skeletal muscles derived from the somites. So when you look at the muscles of body, generally they are derived from the somites. So what are muscles you take? Muscles of the trunk region, right? Muscles of the upper limb, lower limb, they are derived from the somites. Okay, but except some area that we will see later, that is, I will be talking about these muscles, skeletal muscles of visceral. In the neck region, they are derived from branchial arch. I'll show you the picture of branchial arch, then you'll understand. But otherwise, all the muscles are derived from somites. But again, in the head and neck region, what happens is that somite is aggregated into two groups, priotic and occipital myotum, which give rise to muscles of eyeball, here muscles of tongue. So all are general somatic efferent. Yeah. Now we can see that. Again, let me tell you once again about this. General somatic efferent, skeletal muscles derived from somites. Special visceral efferent, that is skeletal muscles derived from visceral arch. Now these are the visceral arch or branchial arch. This can be seen in the neck region. Okay, you can see there are 6 arches which are formed initially, then 2 of them disappears. So which are called as branchial arch. Now branchial arch is a structure which has mesoderm in that. Not only mesoderm, it has all the germ layers. So branchial arch gives or giving rise to some muscles, skeletal muscles. So these skeletal muscles can be seen in the neck region, because the branchial arch is seen in the neck region. So this is another entity or another origin of skeletal muscle. So there are 2 origins, somatic origin, which you can see throughout the body. Skeletal muscles are derived from the somites, all regions. You can see here also there are some muscles which you have seen now. That is muscles of the eyeball, muscles of tongue region, they are derived from somites. But this area, you will see that the skeletal muscles are derived from branchial arch. These are called as visceral efferent component. Visceral efferent component. That is what we saw just now. This way. Okay. Special visceral efferent component. That is the muscles which are derived from the branchial arch. Now let's see the different cranial nerves. The first cranial nerve is olfactory nerve. Now, can somebody tell me what are the functional components it belongs to? What is this nerve? Is it sensory nerve or motor nerve?
Sensory nerve, sir.
Very good. It is sensory nerve. Does it have some motor component? Olfactory nerve?
No, sir.
Very good. What can be the functional component of this? Okay, no problem. Good. So olfactory nerves fibers passes from, you can see here the olfactory nerves in this area, lateral wall and the medial wall of the nose, which are coming from olfactory receptor cells, which are located here in this area, olfactory receptor cells, through cribriform plate. They passes through cribriform plate of ethmoid bone to olfactory bulbs. So they are located in the olfactory bulbs. So olfactory receptor cells are here, olfactory bulb is placed here. Now this is how the olfactory nerve looks like. Now what can be the functional component? Just think of it. We'll see this actually here. Yeah. Now, can you tell me what can be the functional component of olfactory nerve? What is the function of olfactory nerve?
Smell.
Smell, yes. So which is the functional component?
SVA.
Special visceral afferent.
Yes, special visceral afferent. That is a functional component of your olfactory nerve. Okay, now you should tell me next cranial nerve, which is the functional component. So we have seen the first cranial nerve. The second one, that is optic nerve. Optic nerve. So it is the second cranial nerve. Now, what can it be? Optic nerve, sensory or motor?
Sensory.
Sensory, sir.
Yeah, it's a sensory nerve. Okay, is it a pure sensory nerve or mixed sensory nerve or mixed one?
Pure, sir.
Pure, right? Yeah, it's pure
Pure, sir.
sensory nerve. Very good. Pure sensory nerve. You can see the eyeball here and the origin of optic nerve from here. So the optic nerve starts from the retina. Okay, retina is the deepest layer of the eyeball. From there, the optic nerve starts. Okay, retina. This is the structure of retina. Okay, this is outer. This is inner aspect of the retina. Retina has 10 layers. 10 layers, and the last layer is the beginning of the optic nerve. Okay, last layer there are some cells called ganglionic cells. Ganglionic cells, the axons of ganglionic cells are called the optic nerves. Optic nerves. This goes to the brain. Okay. So anyway, there are 10 layers for the retina. So optic nerve starts from the last layer of retina, the deeper layer of retina, that are axons of ganglionic cells. Anyway, so what is the functional component? What do you think about the functional component of optic nerve?
Special somatic afferent.
Special somatic afferent.
Afferent.
Okay. Anyone else? Any other opinion? All are agreeing it, right? Yeah.
Yes, sir.
Anyway, this is beginning as a ganglionic layer of retina. So they are starting from ganglionic layer of retina. Don't have a thinking that it is coming from rods and cones. No, rods and cones are placed here in this area. So the optic nerve is starting as the nerve fiber of ganglionic cell. It exits orbit through optic canal. So from the orbit, it is passing into the brain through the optic nerve. I'm sorry, optic canal. Optic canal. 50% decussation in optic chiasma. Now there will be decussation. That means crossing over. Fibers crossover. That means right optic nerve part of it goes to left. Left optic nerve part of it goes to right. So that is called chiasma. That is crossing over of the fibers can be seen for the optic nerve. Okay, so we are seeing very small, as a summary. Okay, not in detail. The next nerve here is trochlear nerve. This is cranial nerve 4. Now, what do you think about trochlear nerve? Do you know something about trochlear nerve? Have you heard about this?
Yes, sir.
Yes, where you have heard? Tell me. You can see this picture here, right? The trochlear nerve is related to the eyeball, right? Yeah, it is related to the eyeball. It supplies one muscle, right? That muscle is superior oblique, right? SO4. Now, is it a motor or sensory nerve?
Motor nerve, sir.
Yes, it's a motor nerve. Is it pure motor or
Yes, sir.
mixed? Yeah, it's a pure motor nerve. Yes, it's a pure motor nerve. Yeah. What can be the functional component of this if it is motor? What do you think? Okay, I just mentioned that these eyeball muscles are derived from myotomes, somites, isn't it? I just mentioned here. See, preotic myotomes. They are going to give rise to skeletal muscles. That is extrinsic muscles of the eyeball, right? Here, extrinsic muscles. They are also skeletal muscles, right? So, which component is supplying the muscles which are derived from the somites? Which component?
General somatic efferent.
Yes, general somatic efferent. So the trochlear nerve has got general somatic efferent component. That's what. This is what you should correlate. Okay. So whenever you hear about a nerve, cranial nerve, just think of the functional component. So it enters the orbit through superior orbital fissure. First of all, let me tell you that trochlear nerve is arising from here, almost at the level of midbrain. Okay. This is brainstem. There you can see midbrain. This is midbrain, pons, and medulla oblongata, and it is originating in the region midbrain. Then it passes through the superior orbital fissure. This is superior orbital fissure. The trochlear nerve that enters into the orbit through that. It innervates superior oblique muscle of the eye. It is only crossed cranial nerve. Here you cannot see the crossing, but actually what happens here is that the nerve here, this one, the crossing over is taking place inside the brain matter. Inside the brain matter, that is why you're not able to see it. I can explain you in this way that this nerve is actually coming from here, from the other side. This is coming from this side. Okay, so they cross internally. There is an internal crossing of trochlear nerve that you cannot see because it happens inside the brain matter. That is why you cannot see it. This is the only crossed cranial nerve. Okay, only cranial nerve that emerges dorsally. One more thing is that this nerve arises from the posterior aspect of the brainstem. Usually all the cranial nerves are coming from the anterior aspect, but this comes from the posterior aspect of the brainstem. That is other peculiarity.